Hi everybody, my name is Amanda from beautifulnursing.com, and I wanted to make this video today because I've been getting a lot of messages from people that have failed the NCLEX from using a variety of resources all over the internet, spending tons of time studying, spending tons of money, and yet they still fail. So I wanted to talk to you guys about why this reason could be, from what I've seen, and how you can avoid this from happening to you. And I just want to say that if you are watching this video because you just failed the NCLEX or failed a nursing exam, it is more common than you think. You are so not alone. It's just not as talked about. So people sometimes feel really ashamed and really overwhelmed, and they just don't want to talk about it. I know that you're smart enough to do it. Everyone I've talked to that failed the exam, that retook it, pass, because they are smart enough to do this, and you are too. So let's talk about what tips I gave them so you can pass. What you're waiting for, what is the reason that people fail? So it's, again, not because people are not smart enough to take the NCLEX or that they don't know the knowledge. It's because people struggle with answering NCLEX style questions and their test anxiety gets the best of them. I was the kind of person that had to study so hard for my grades. You guys, I went from barely passing to a 4.0 GPA. And I also passed my NCLEX in 75 questions. So if I can do these things, I know that you can too. So we are gonna go over the way to kind of coax the answer out of NCLEX style questions, even when you don't really necessarily know the answer. Trust me, this is the it video that you're gonna wanna save, rewatch 1,000 times, whether you're in nursing school, about to take the NCLEX, or if you know somebody that is. This is the video, okay? So let's get started. When you're reading an exam question, quickly block out the answers. Do not look at the answers, and there's a reason why. So when you're looking at the question, I want you to try to think of any knowledge that you can possibly think of about the subject, because if you can try to remember any information you remember on the subject, it might actually give you the answer before you look at the answers in front of you. Because if you look at the answers first, it might bias you towards a certain answer, and then you might get it wrong. So again, try to think of what knowledge you know about the subject, and then look at the answers and try to see what's closest to what you remember. Okay, let's try one. Let's cover the answer. The nurse has been teaching the role of diet in regulating blood pressure to a client with hypertension. Which meal selection indicates that the client understands their new diet? So before we look at the answers, remember, you're going to cover them up and try to think of any information you can remember. So just take a few moments, pause your screen, think about what you can remember, and just come back. All right, so hopefully maybe salt came to your mind, that salt increases blood pressure. Maybe the DASH diet also came to your mind. The DASH diet is the dietary approach to stop hypertension. It includes decreasing sodium, saturated fats, and increasing veggies, fruits, and whole grains. So now let's look at the answers. All right, so A, we have cornflakes, whole milk, and a banana. B, we have scrambled eggs, bacon, and buttered toast. C, we have oatmeal, apple juice, and dry toast. And D, we have pancakes, ham, and tomato juice. I don't know about you guys, but when I see bacon and buttered toast together, I think high sodium right away. So I'm going to cross that one out right away. And then when I see ham and tomato juice as well, I want to cross out because those also have high sodium and high cholesterol. All right, so let's talk these last ones through. So, all right, so cornflakes, whole milk, and a banana versus oatmeal, apple juice, and dry toast. So cornflakes, I don't know much about cornflakes other than that I use them for cooking. I don't know. Whole milk, that doesn't have a lot of fiber. In fact, that makes you more constipated. Banana, that's a fruit, but oatmeal, on the other hand, that has a lot of fiber. Apple juice, again, you get that fruit, and then dry toast is whole grains. So that's 3 things versus the 1 and cornflakes, I think that has high sodium, so let's check what the answer is. I think we're gonna go with C, guys. It is C. Study tip number 2. Look for key words and phrases in the stem of the question that matches the answer. So we're looking here, if they're trying to look for some kind of assessment, or are they looking for some kind of, intervention? What are they looking for? It doesn't match with the question. So let's do an example of this here. All right, so let's start by covering those answers. And the question is, the nurse is caring for the patient's post-surgical removal of a 6mm cancerous oral lesion. What is the priority nursing measure for this client? So looking in the stem of the question, what is the priority nursing measure for this client? The measure usually means what is the care or the intervention that the nurse is going to do. So if we are going to be looking at interventions, think in your mind again of any information you can rack in your brain about what interventions we might perform that are the priority to keep this post-surgical patient safe. So think of what safety complications, what safety concerns we might have for post-surgical patients. Think about that real quick and we'll come right back. Okay, here is our answers. We have A, maintain a patent airway. B, perform meticulous oral care every 2 hours. C, ensure that incisional area is kept as dry as possible. And D, assess the client frequently for pain using the visual analog scale. All right, so right away, I want you guys to remember that we're trying to match the stem of the question. So this question is asking us for an intervention, and right away I saw that D says we are going to assess the client's pain. So that is an assessment. It is not an intervention. So let's cross that one out right away. All right, so then C, ensure that the incisional area is kept dry. So again, if you're thinking in your mind of the nurse going over there to look at the incisional area, that again is another assessment, not an intervention, because the nurse is going to look and assess how that incision looks. So that one we are going to cross out as well. That leaves us with A, maintain a patent airway, and B, perform meticulous oral care every 2 hours. So we are looking for the priority nursing intervention for this client. So I hope you guys thought with post-operative clients that they are in the PACU after having anesthesia. Hopefully you thought of the ABCs when it comes to more emergent cases. This is airway, breathing, and circulation. Airway is making sure there's nothing blocking that airway with them getting air in and out. Breathing, making sure they are breathing successfully, and circulation, making sure that they are getting good blood flow to all extremities, that they don't have any kind of clot, so checking their pulses. So when we are looking at the priority here, it is going to be A. Finally, I added a few key terms that you might see on assessment versus intervention questions that you might see on the NCLEX. Next study tip, this one is a hard one. Cross out the obvious incorrect answers. I know some of you are like, you cross it out and then you're like, but there's a reason you felt that way. Just trust your gut, because sometimes you go back and then you hear the answer from your professor and instructor and you're like, wait, why didn't I just go with my gut? Just do it. And then if you get it wrong, you'll remember for the next exam, or if you have to retake the NCLEX again, you'll never forget it again. So just be done with it, okay? And then study it for the next time around. So cross out all the incorrect answers that you think and trust your gut. So when it comes to those dreaded SATA questions, those select all that apply, saying which ones are correct, I remember my first nursing exam with those. I failed with a 58%. I already felt like I wasn't smart enough in the first semester of nursing school. And then when that test came back, I was like, oh my gosh. So with those, a really great exam tip that I got from another cohort member was that you can make every answer on a SATA question into a true or false statement. And this really helped me because it helped me look at each answer individually to the question instead of looking at all of them together, because that's kind of what messed me up. So when I looked individually each one and I thought, okay, does this one fit with this question? And then I could just cross it out and then, you know, it would leave me with which ones. And when it comes to SATA, you know, it could either be just one of them or all 5 or 6 that could apply for this question. Okay, let's try one. So cover your answers. The nurse was just assigned a 3-year-old diagnosed with measles on a pediatric unit. Which preventative measures should the nurse take when providing care? Select all that apply. So the first thing I want you to do, besides covering the answers, is try to think of any information again that you remember about measles. Which safety precaution is that going to fall under? And then what equipment or measures is also under that specific precaution. So pause the screen, take a minute, and come back. All right, before we look at the answers, I'm gonna give you guys one more hint from a little TikTok I made on which safety precaution measles might be.
Go to room 2. Suit up, they have measles.
Which safety precaution is that? Standard, they're for everyone. It's like, where's Waldo? Okay, girl, drop it like it's hot for you. Ooh, come on, guys. Do not come into contact with anything in this sewer. Unless it's a Ninja Turtle. Hi, welcome to MTV. Oh my gosh, thank you so much for flying all this way in the air. We even got you a private room and hooked you up with a real sexified mask called N95. All right, so hopefully you gathered that it's airborne precautions. So let's look at our answers. We have A, hand hygiene, B, goggles, C, N95 mask, D, a surgical mask, E, a negative pressure room, and F, disposable equipment. So let's turn each of these answers into a true and false statement. So simply put, which of these is going to fall under those airborne precautions? So right away with C and D, I see 2 masks on here, and usually they both can't fall under the same precaution. So I have to kind of think or just memorize, you know, which one is under which precaution. So is a N95 mask under airborne precautions, true or false? I know that this is true, so I would mark down that surgical mask that is false, so we're gonna cross that out. Jumping down to F, is disposable equipment considered airborne precautions, true or false? So when I think of disposable equipment, I think of somebody touching it and contaminating it, like, you know, with MRSA, skin infections. So that is touch, contact, not airborne. So I think we're gonna cross that one out. All right, so B, goggles. So usually goggles are used by the nurse if there is a possibility of being sprayed or exposed to respiratory secretions or body fluids. So that is, I know, in standard precautions, you use it as needed, but I don't believe that's airborne. So we're also going to cross out goggles as well. Not forget about E. So a negative pressure room is true because it is like a vacuum. It keeps the bacteria or virus from the patient confined in the patient's room, so it won't spread to other patients or hospital workers. And then finally, hand hygiene is always true. So you're left with A, C, and E. Next study tips, so usually in multiple choice, if 2 answers are the same, usually both are wrong. Versus if 2 answers are opposite, usually one is right. All right, so next study tip. So as you guys have probably learned through nursing school, So in the medical world, you know, things are never really just black and white. There's always some kind of gray area to every kind of disorder and medication. So when you ever see a absolute word like always or never,
run.
Because these kind of answers are saying that they apply to a whole population of everybody. For this type of patient, you always want to do this. For this nurse, you always or never do this. Usually these are never going to be the right answer because they just don't apply to everybody because there's always that gray area. So if you see absolute answers like always or never, usually those aren't the answer. So let's talk about stable versus unstable, or otherwise known as like chronic versus acute, because this is big when you are prioritizing patient care. So when you have somebody that's stable, usually you're thinking of somebody that has chronic illnesses, that is post-op for over 12 hours. Maybe they've been sitting in a bed for 5 days, they are ready to go home. That's had like an unchanged assessment. They're having symptoms that are common for their disorder. Let's say that they are having ear pain, but they have an ear infection, right? That's not unstable because that is common for their disorder. Now, if they started having nuchal rigidity, right, a stiff neck and a positive Brudzinski sign, I can't ever pronounce that, with an ear infection, maybe that's a little bit unstable and you might be thinking meningitis, right? Then they'd be over in that unstable category. Admitted for over 24 hours. Again, they are going to be considered stable, chronic. So you would prioritize these little dumplings a little less than these people in the unstable category. And so when you're picking which client to see first, the nurse should see these unstable clients first, because these are the people that if you were going to send them home, they probably wouldn't have a good chance of survival. You want to make sure that they're going to be safe. So let's talk about what qualifies these people as unstable. Well, again, could be categorized as acute. So maybe they're post-op for less than 12 hours. Maybe they have a rapidly changing assessment. So their blood pressure is quickly changing, or their heart rate is, deteriorating, and you've noticed that as the nurse. So their vitals are changing quickly. They could be newly diagnosed with something, or they could start again developing some kind of symptoms that are unusual for what they were diagnosed with. So maybe this person came in with a burn injury, and on their way out, you see that they had different handwriting and their face is drooping, and all of a sudden, okay, they're unstable again as you were about to discharge them because they've been there a couple days. So they again are considered unstable because they're having changed assessments, and you are thinking, oh my gosh, is this person possibly having a stroke? So these are considered unstable patients, and you are going to prioritize them first. All right, so let's try a prioritization question together, and we're not going to cover the answers because obviously we don't have enough information first. So let's look at the question. After a change of shift, you were assigned to care for the following patients. Which patient should you assess first? A 37-year-old with a history of asthma, complaining of shortness of breath after using a bronchodilator. B, a 52-year-old diagnosed with COPD for over 10 years and just had a pulse ox reading of 90% saturation. C, a 75-year-old on a ventilator who requires a sputum sample per the provider's orders. Or D, a 69-year-old recently diagnosed with pneumonia and is having a fever of 100.4. So I want you to look at these real quick, try to think about which one you think is the answer. You can pause the screen here, come back, and then we'll talk about it. So let's start with A. We have this 37-year-old with the history of asthma. When I see that, I think of stable. So they have a history, it's chronic, it's been happening. So right away I think stable, but it also shows here in the second part that they are complaining of shortness of breath even after using a bronchodilator. So even though I thought it was stable, I can definitely say now that this patient would probably be marked in that unstable category, making them a higher priority. So I'm going to leave that one and not cross it out yet because I think that patient would be a high priority. All right, so now let's look at B. We have that 52-year-old diagnosed with COPD for over 10 years. So I'm automatically thinking stable again. It's a chronic condition, so they've had it a while, so that's stable. And then they just had a pulse ox reading of 90% saturation. Remember, normal is at 95 to 100, but COPD patients can run lower, and that's normal for them because they have had that obstructed airflow in the lungs. So this also would be considered still a stable situation that is expected for their diagnosis. So that one we actually could cross out. Okay, and then we have C, a 75-year-old on a ventilator who requires a sputum sample. Okay, so when I think about ventilators, sometimes I do think about complications like a leak, but nowhere in this answer does it talk about any of that or alarms going off. So we can assume that this is a stable situation with this client on this ventilator, and all they are requiring right now is a sputum sample. The only thing is sometimes these samples have a time frame attached where they have to be delivered to the lab within like an hour. But otherwise, this is a non-urgent request, so we're going to cross this one out. All right, that leaves us with D, a 69-year-old recently diagnosed with pneumonia. So recently diagnosed set off bells for me because I think unstable, that's like recently admitted, changed assessment, post-op less than 12 hours, acute. So let's keep reading. And is having a fever of 100.4. So then I think stable. And the reason is because this is a common symptom of somebody with pneumonia. Now, a 69-year-old having pneumonia with a fever is still something that I would definitely want to prioritize. But when I have two different answers here that are looking unstable, and I want to make sure that they're both going to be kept safe, I would definitely prioritize A, and the reason is because this is an airway issue. This is an issue with breathing versus an issue with a infection. So if you're, again, looking at those ABCs, airway, breathing, circulation, we are going to prioritize our patient with shortness of breath first because they are just not having any kind of relief with their medications.
Next study tip. So as the nurse, when you are looking at different interventions that the nurse could start, always start with the least invasive one first. So if there's different things for like fluid resuscitation, you could give like the patient water PO, so just normal by mouth intake, start a peripheral line IV, a central line IV, like different ways, right? We want to start with something by mouth because if we start a peripheral or central line, like those increase the patient's risk of infection. We want to always be thinking about safety. Do least invasive option first, unless there obviously is a problem in the question with the patient swallowing or something else in that question where the patient just can't take fluids by mouth. So choose least invasive first. All right, so the next study tip is with therapeutic communication. So you do not want to ask yes or no questions except with self-harm. Self-harm is the only one that you're gonna ask, okay, have you had any thoughts of hurting yourself? Yes or no? Otherwise, you always wanna have open-ended questions with your patient. So, what are you feeling today? What are your plans today? What symptoms are you having? Open-ended so they can really kind of express what they're feeling, so you can get more information and assessments from them. So these type of questions allow the nurse to have more information on the patient versus those closed-end questions that are yes or no. Do not give the nurse as much information. So you want to save those only for self-harm. So remember that for the NCLEX, only use it for self-harm.
All right, so let's try an NCLEX style question together and cover the answers. So here's the question. The nurse is caring for a 28-year-old client who is having surgery the next day. The client verbalizes, I am scared about surgery. I've never had surgery before and I'm afraid I might die. Which response by the nurse is the most therapeutic? So I want you to real quick think about all those different therapeutic communication techniques that I talked about earlier and how you would respond as the nurse to this client. So take a minute, think about your response, and then we'll come back and look at the different answers. All right, let's look at the answers. We have A, we can call the doctor and cancel the surgery. B, it is normal to be afraid of something new like surgery. Tell me how you feel. C, don't worry, you have a good doctor and they do not make mistakes. Or D, I am sorry to hear that, but why are you worried about a minor procedure? All right, so if we start at the top with A, we can call the doctor and cancel the surgery. So as a nurse, this one is not the best answer because we're not really addressing what their actual fears are. And this client obviously needs the surgery the next day. So this one wouldn't be the most therapeutic, the most helpful for this client. So I think this one we can definitely cross out. And then B, it is normal to be afraid of something new like surgery. Tell me how you feel. That's a good one. I feel like it's not only comforting, but it's an open-ended question that allows the patient to really express how they're feeling. So let's not cross that one out because I feel like that's a really good answer. So let's check out the next one. C, it says, don't worry, you have a good doctor. I don't like the don't worry so far. You have a good doctor and they do not make mistakes. Yeah, not the greatest because to err is human. Everyone does make mistakes sometimes, and promising that is not the best idea. So I would definitely cross that one out. All right, and then finally we have D. I'm sorry to hear that, but why are you worried about a minor procedure? I don't like that why. It's kind of condescending, making them feel belittled for talking about their fears. It started out really good with the I'm sorry to hear that, but when they say, why are you worried, and calling it a minor procedure, it's still a very scary thing, especially when it's your first time getting surgery. I still get scared every single time I go in for surgery. I haven't had surgery many times, but it's still a scary thing. So that is not therapeutic. That's nothing that would definitely comfort a patient. So let's cross that one out, and that leaves us with B.
So this study tip, I remember getting this question wrong on a nursing exam because it was a nurse walking into the room and the patient was having trouble breathing, and the answers were like, do you want to listen to their lungs, apply oxygen, give them a bronchodilator, or something else? And I remember the first thing I said was listen to the lungs, which was wrong. And I was so sure I was right. And now that I think about it, I get why I was wrong. So here is my next study tip. Assess unless in distress. So when you think of ADPI, you would do the assessments first and then you do your interventions, except if it's an emergency situation. So if your patient is having trouble breathing, or if there is some kind of emergency situation going on, you're gonna wanna do the first thing that's gonna help your patient. So if that is raising the head of the bed, applying oxygen, doing whatever you can to help that patient in the moment before you do those different type of assessments. I remember, getting that question wrong, and my teachers had to explain that because in my brain was like, add pi, I should assess first what's going on, but my teachers were like, no, your patient is deteriorating, like you gotta go help them before you listen to their lung sounds. So again, assess unless in distress. You guys remember from fundamentals, Maslow's hierarchy of needs. So with that, the biggest takeaway is that the patient's physical needs, so air, water, food, shelter, that should be prioritized over their psychosocial, so their mental health, their emotional well-being. So, when you're prioritizing your patient care, their physical needs are going to come before their psychosocial needs. So when you're prioritizing, just remember Maslow's. Next study tip, if you have never heard of an answer, just don't pick it. I know you're probably like panicking, like, oh my gosh, I just don't know the answer to this question, and I just don't know what to pick. Pick something you've heard of, because there's a chance if you've heard it in lecture, maybe it's because it's the right answer. And if you've never heard it, there's not a chance that it's the right answer because you haven't heard it in lecture, you haven't heard it in your book. So pick something you actually have heard in lecture or from your instructors. Don't pick something you haven't heard of. Okay, so if you see a question that asks you, what is the nurse's best action? That means what is the one thing that the nurse can do that might actually solve this problem. So let's do a question like this together and talk through it. So in some of these NCLEX questions, you might see something that says, what is the first thing that the nurse should do? So when you're looking at a list of chronological steps that the nurse should do for a certain task, what is the actual first thing that the nurse is going to do? So let's say that they are going to insert a Foley catheter. What is the first thing that the nurse is going to do, right? So it could be, if there's a list and it says hand hygiene, lubricate tip of catheter, insert saline into balloon, cleanse urinary meatus, right? The first thing you'd probably say is the hand hygiene. So in a list of all these different steps, the first thing you're going to say is that first step. So when you say the nurse's first action, it's the first in the steps. Let's try an NCLEX style question and cover the answers. A 34-year-old client in the last trimester is admitted to the labor and delivery unit complaining of vaginal bleeding with very little discomfort. The nurse's first action should be to, so again, try to think of any information that you can on the subject and think about in a list of steps, what should the nurse do first? So again, this is where you pause the screen and try to think of what the nurse should do in this situation. All right, so hopefully you remembered the two big bleeding disorders that you see in late pregnancy is placenta previa and abruptio placentae. So a little mnemonic that's in my book to remember is with the placenta previa, just remember the P's. Placenta painless. So usually see that painless bright red vaginal bleeding in placenta previa. So that's where the placenta implants in the lower part of the uterus or cervical os instead of the fundus. Versus abruptio placentae, remember the A's, abruptio, abdominal pain. That's where there is a premature separation of the placenta from the uterus. So that is very painful. So you're going to have that abdominal pain, that dark red vaginal bleeding. So now that you know this information, let's look at those answers. All right, so our answers could be A, assess fetal heart tones, B, check for cervical dilation, C, check for firmness of uterus, or D, obtain a detailed history. So right away, I think D is probably going to be crossed out just because of that tip I said of assess unless in distress. Now, we have a client coming in with vaginal bleeding in a late trimester. Now, bleeding during pregnancy is not normal, especially in a late trimester. And if we are just asking many questions without intervening, we could be increasing the client and their baby's chance of complications or mortality. So we want to intervene right away and make sure we're going to be keeping our clients safe. So we're going to cross out D because this is just going to harm our clients. All right, so the next one that also sticks out is B, check for cervical dilation, because doing a vaginal exam on a client with placenta previa is a big no-no. It is contraindicated because it can induce more bleeding and result in a severe hemorrhage. So let's cross that one out right away too. All right, so then we're down to A or C, which both seem like good answers for this client. But when we come to the first action, so if it's a list of steps and we have these two interventions, with interventions, again, another tip I gave was do the least invasive first. And again, we're thinking of safety. So which one would be least invasive? It'd probably be assess fetal heart tones. And that is the correct answer.
And I wasn't going to announce this, but I'm just going to do it. I was on the pilot program for the next generation 2023 NCLEX. And so I do want to make a whole video about this NCLEX, how it's different than the one now. But I will say this, that the information that you need to know for this next NCLEX is the same. So you should be studying the same. It's just that the way that the information is presented is going to be different. And I will talk about the way that they set up the questions because there is a different way that they do it, but you still need to know the same information. So make sure to check out my 1-hour NCLEX review video. It goes over all the big safety topics that you need to know for the NCLEX. And otherwise, you guys, I really wish you luck this time around. And I also do have a $5 NCLEX bundle that is available on Etsy. If anybody needs that extra little NCLEX review, it just, again, goes over more information that you should know for the NCLEX. It's less than the price of a hamburger. So I just wanted to make things really affordable and make things really easy so you guys can pass. I just want you guys to pass. You guys luck. If you guys need anything at all, just leave a message in the comments. I'll try to get to it. All right. Bye, you guys. Bye.